22-year-old Saida lives in Djibouti with her husband and 2 sons. She found out she was HIV positive shortly before giving birth to her youngest, who is now 11 months old.
At the beginning, I was really sick. I was vomiting and I had a lot of diarrhea. Even my heart was racing.
At first, it was difficult for her to accept her diagnosis, especially after her best friend died from AIDS. But psychological training has helped her to come to terms with it.
I would have been dead. People used to say it was TB, and beforehand people were dying. But now they test for HIV. There's the Pmtct program. They can take care of you and you can survive.
The Unicef-supported nationwide program focuses on preventing HIV transmission from mother to child. It recognizes the importance of maternal health on entire families and provides full support for women like Saida. Her oldest son is HIV negative, and her youngest won't have a conclusive diagnosis for a few months. But both children are monitored by healthcare workers and are given special baby formula. Along with drugs and counselling, Saida receives food rations for her family when she needs them.
Sometimes there's a shortage of food, and during this time it's hard.
Because of the work of UNICEF and its partners, the scene in this consulting room, where a midwife explains the importance of an HIV test to an expectant mother, is being repeated all over the country. In this clinic alone, between 60 and 70 women are tested every week.
We take care of the woman. We explain the seriousness of the disease, how she can protect herself, and we talk to the partner and take care of the baby. That means making sure that the baby is born in good condition, that it's a healthy child. Even if the woman is HIV positive, we want to make sure that the child is healthy.
The program is one example of several successful programs in the region which offer a holistic, integrated approach to HIV prevention and are backed by a sustainable expansion plan.
The success of this project in Djibouti will definitely motivate other MENA countries to similarly scale up services. And this is so because the project has proven to address the underlying factors that were preventing utilization of prevention, treatment and care support services.
From putting the newborn babies of HIV-positive mothers on an immediate regimen of antiretrovirals, to training more medical staff to spread the message of HIV prevention, UNICEF and its partners in Djibouti are demonstrating that knowledge and education are one of the most important aspects of HIV/AIDS prevention.
La PTPE, ou la prévention de la transmission.
The benefits of the Pmtct experience in Djibouti is that it's allowed us to test more people and to make testing more of a standard procedure, extending knowledge to more health workers. In this way, it's helping to prevent the transmission of HIV from mother to child.
Because of the support of UNICEF and its partners, life has improved for Saida. She's become one of the first women in Djibouti to speak in public about living with HIV. That testimony is positive. Saida is healthy, and because of that, her whole family is better.
Thanks to the Pmtct program, as you can see, I can do the washing, I can cook, and I can get around.
In a country where reaching a clinic can mean a journey of days, the challenge of getting pregnant women and their children to return for follow-up treatment are enormous. With your support, UNICEF and its partners can extend the reach of this successful program and make sure that the message of HIV prevention reaches as many people as possible.